Hello, friends. Today we are going to discuss Know Your Backache, which is cured naturally. There is a quote by George Burns: "Love is a lot like backache. It doesn't show up on X-rays, but you know it's there." I am Dr. Jagatjit Singh Virk, giving you this session. Why is my lower back inflamed? When the lumbar lower spine is strained or sprained, the muscles and tissues become swollen. This inflammation causes pain and may cause muscle spasm. Rest your lower back to counter the pain, depending on the severity of your symptoms. This may simply mean reducing your level of activity for a couple of days. Bed rest is no longer recommended for treatment of low back pain, except for short periods of time. Lying on your back with a pillow under your knees helps keep your back in a neutral position. You might also find some relief by lying on the floor with your knees bent at a 90-degree angle and propped on a chair. However, don't rest for too long. Many cases of lower back pain resolve themselves within a couple of days. Longer period of inactivity can actually cause your muscles to weaken. 9 tips for managing inflammatory back pain. Stay physically active to ease inflammatory back pain, unlike mechanical strengthening and stretching. Avoid high-impact exercises, seated thoracic extension. Do deep breathing exercises to maintain lung capacity. Learn to lift heavy items properly. Be careful while driving. Choose the right mattress. A firm mattress, sleep on abdomen 30 minutes each night, a full sleep. Fall-proof your home to prevent fractures. Consider a raised toilet seat for comfort. Adapt your workspace for good posture. Release your inner endorphins. Certain activities may boost your endorphins level, such as aerobic exercise, massage therapy, or meditation. What is the fastest way to get rid of inflammation? Drink water. Drinking lots of water and staying properly hydrated is probably the easiest way to reduce inflammation. If your body is getting enough water, your joints will move more freely and easily, leading to less pain. Get moving. Many of us have fallen into more sedentary lifestyles because of the pandemic. Dehydration causes the spinal discs to lose water, resulting in back pain. When those discs aren't hydrated as they should be, your spine ends up suffering the consequences by taking on the full shock of your movements, which leads to pain. How to reduce inflammation in the body? Follow these 6 tips for reducing inflammation in your body. Lead up on anti-inflammatory foods. Main fruits and vegetables. Those are anti-inflammatory foods include grapes, celery, blueberries, garlic, olive oil, tea, and some spices. Ginger, rosemary, and turmeric. Cut back or eliminate inflammatory foods. Inflammatory foods include red meat and anything with trans fats, such as margarine, corn oil, deep fried foods, and most processed foods. Control blood sugar. Limit or avoid simple carbohydrates such as white flour, white rice, refined sugar, and anything with high fructose corn syrup. Anything white you can avoid. Make time to exercise. Make time for 30 to 40 minutes, 5 minutes of aerobic exercise and 10 to 25 minutes of weight or resistance training, at least 4 to 5 times per week. Lose weight. Manage stress. Chronic stress contributes to inflammation. Use meditation, yoga, biofeedback, guided imagery, or some other method to manage stress throughout the day. We may not be able to change many of the stressful situations we encounter in life, but we can change our response and perception by learning to manage stress better. What are the best herbs for back pain? Anti-inflammatory herbs including ginger, ginger official rhizome, turmeric, curcuma longa rhizome, devil's claw, harpa go phytum, procumbens tuber, licorice glycyrrhiza glabra rhizome, and European golden rod solidago varguria are useful in treating back and neck. What's the fastest way to relieve back pain? Exercise has been found to be one of the most effective ways to relieve back pain quickly. Try swimming, walking, yoga, retraining your posture, testing the limits of pain tolerance, stretching and flexibility exercises, aerobic exercises, core strengthening exercises. Meditation and mindfulness. Chronic back pain is straining both physically and emotionally. To manage the frustration, irritability, depression, and other psychological aspects of dealing with chronic pain, you may get referred to a rehabilitation psychologist. This specialist may recommend meditation, yoga, tai chi, and other cognitive and relaxation strategy to keep your mind from focusing on pain. Lifestyle modifications. When you have chronic pain, it's important to accept your limitations and adapt. Listen to your body and learn to pace yourself. Take a break when mowing the lawn, or make several trips when carrying groceries. Take note of the activities that worsen your pain and avoid them if possible. Not only could this help your back feel better, it could also prevent the underlying condition from advancing. Another important lifestyle change to try is giving up smoking. Nicotine is scientifically known to accentuate pain and delay healing. Alternate treatments. Acupuncture, massage, biofeedback therapy, laser therapy, electrical nerve stimulation, and other non-surgical spine treatments can also make a difference for chronic back pain. Talk to your spine specialist about alternative treatments that could benefit you. Which tea is good for backache? Green tea probably works best as part of an anti-inflammatory lifestyle and associated nutritional changes that can help the body combat inflammation. Other teas that researchers believe reduce inflammation include turmeric, holy basil, and ginger. Can lying down too much cause back pain? If you oversleep on a bad mattress, your body will be exposed to uncomfortable sleeping conditions for a longer period. This can affect the natural curve of your spine and lead to back pain. Laying on your back for long periods can cause the muscles that support the normal curvature of your back to become fatigued. Is walking good for back pain? The simple movement of walking is one of the best things we can do for chronic lower back pain. 10 to 15 minutes of walking twice a day will help ease lower back pain. Substitute this activity for a more vigorous type of exercise if you prefer and or are able. Foods to avoid while experiencing backache. Sugary foods are among the worst foods that you can eat. Vegetable oil. Most vegetables are high in omega-6 fatty acids. Refined grains. It is best to eat whole grains instead of refined grains. Dairy products, processed corn, red meat, foods with chemicals, all these to be avoided. How do I know if my back pain is serious? 8 signs that it's time to call a doctor for your back pain. You have been in pain for over a week. Your pain extends to other body parts. You have numbness, tingling, or weakness. You have pain after an accident. Your pain is worse at certain times or in certain positions. You are having problems with your bowels or urination. All these are serious conditions and you must consult your doctor for it. What causes back pain in females? Upper back pain in women is usually due to poor posture, like slouching or pushing the head forward while sitting or standing, causing misalignment of the spine. Muscle overuse or strain, usually due to repetitive motions or lifting items or children incorrectly. Injury to discs, muscles, and or ligaments. What organs can cause lower back pain? As well, organs such as the kidneys, pancreas, colon, and uterus are located near your lower back. All of these can be responsible for pain in the left side of your lower back. So there are many potential causes. While many require treatment, most aren't serious. Why do diabetics have back pain? Diabetes is a risk factor for lower back pain. The noticeably higher risks of spinal pain may be the result of diabetes-related imbalances in blood sugar, insulin, and free radicals, which place unhealthy stress on spinal discs. What exercises to avoid if you have lower back pain? Here are the exercises to avoid if you have back pain and which to do next instead. Avoid crunches. Try this instead. Modified sit-ups. Avoid high impact activities. Try this instead. Water aerobics or yoga. Avoid running. Try this instead. Walking. Avoid biking off-road. Try this instead. Use a recumbent bike. Can I prevent the low back ache? You can't prevent lower back pain that results from disease or structural problems in the spine, but you can avoid injuries that cause back pain. To reduce your risk of a back injury, you should maintain a healthy weight. Excess weight puts pressure on vertebrae and discs. Strengthen your abdominal muscles, pilates, and other exercise programs. Strengthen core muscles that support the spine. Lift the right way to avoid injuries. Lift with your legs, not your back. Hold heavy items close to your body. Try not to twist your torso while you are lifting. This was all about your natural healing of back pain. Thank you very much.